So I have a patient here with a pelvic fracture who meets our criteria for transfusion. So he's got a pulse of 130, he has a systolic of 80, and he has fast positive on ultrasound. So I think if you're in agreement, we should go ahead and transfuse him.
We should transfuse.
Okay, so we've got our eyewear on. Are we treating or bleeding? Yes, I think we've got our pelvic wrap on. There's nothing else we can treat at the moment. Let's give our 1 gram of tranexamic acid. And we'll follow that with a flush. So that is in. So our next step, so we seek consent where we can, but he's not fully conscious, so we'll move on and just have implied consent. So we've decided we're going to transfuse. Once the seal's cracked, there's no going back, and the blood needs to be given. So we'll open our seal. So in here we have a mock-up of the data logger, which we need to be careful not to lose. Normally the blood will come obviously not attached, but this is attached because it's already been previously spiked. So we take it out, we give it a gentle agitation.
Okay.
And then we'll need to prime our lines. So, well, what we'll do is we'll spike it first. So just gently spike it, making sure we don't. So let's, okay. So you've got to pull the tags, and you can use either one.
Okay.
And then you gently push this in, but firmly and gently, not aiming not to go through the side of the packet.
Understood.
And you'll best spike it with this closed. Then you need to lift the bag up, and you need to prime the line in this position.
Do you want somebody to hold that IV for you?
We've got an IV pole over here.
Awesome.
So I'm just going to simulate what to do if we get a little bit of air in the line, which you don't want to do, but this is how you prime it to avoid air. So let's do it incorrectly. So this is what you do not want to do. So now you have some air in the line.
Okay.
You want to close the distal part. You want to twist the valve. And you want to close this down here. And then you want to pump the air back up.
Understood. Okay. So that's troubleshooting.
Alright.
Got it?
Okay, so that's our line primed.
Okay.
So our next step, we want to just check that we have the correct unit. So we have our donation number up here, 5260097. That must match this, 5260097.
Confirm.
We want to check that the blood unit is not expired, so it expires 31 of October. So we
Oh,
can
RH negative.
And we have our RH negative blood. So then we can connect up our transfusion to the largest IV possible, and then we can open our line and start transfusing.
Understood.
So the next step is just to attach our pre-hospitally transfused bracelet to the patient. Contains specific requests such as for equipment, such as activating the massive transfusion protocol, maybe a request for a thoracotomy set to be ready in ED, and we may want to have an operating room prepared depending on the situation. And then we need to hand over that the patient has been transfused. We need to ask that the lab is informed, the blood bank is informed the patient has been transfused. We can cut off the transfused patient bracelet, can go with the cross-match request to the lab. We need to complete a couple of pieces of paperwork which are going to sit on the top of the bag. So we have our ADHB transfusion record, and we need to I'll just take that back from you. So once the blood transfusion is complete, we need to remove this sticker.
Understood.
And this comes off and attaches here.
Got it. Okay.
And
Fantastic.
the final piece of documentation is when the handover at the end when we're returning the used packet of blood, we just need to put the information on our transfused patient details form.